Hi, I'm Laura, and I wanted to talk to you about neuromas. Neuromas are a nerve injury that typically happen in the third and fourth space, but can happen in between the other rays as well. The reason it's more common in between the third and fourth ray is because the nerve splits and shares the innervation of those two toes. This can happen from a multitude of reasons. Typically, there can be too tight of footwear, mechanics. So if the foot is really collapsed and pronated and the foot's splaying out, that can cause tension and pressure on the deep transverse metatarsal ligament. And that, in effect, puts pressure on the nerve, causing inflammation to that nerve and pain. Signs and symptoms typically include shock-like sensation, numbness, feeling like a pebble, or a sock that's rolled up under their foot. How do we treat this? Typically, we want to have proper footwear. So the first thing I always recommend is a lower drop shoe so that we're not in this pitch, a wide toe box, okay? Metatarsal support is very important because that helps to support the rays so they don't collapse and cause a space for that nerve. So that is done with metatarsal pads as well as neuroma pads or plugs that are placed in the appropriate position. If one is still dealing with issues despite the conservative measures, the other option are ultrasound guided injections. So steroid injections is typically what is done in this area. That can take effect. It sometimes can take up to 2 weeks to start to feel that effect, and we can do up to 3 in a year. The results are actually quite good with a steroid injection, an ultrasound guided steroid injection for a neuroma. If that doesn't work for people, then the next step would be surgery. So there's newer technology, nerve decompression, which is similar to when people have, say, carpal tunnel, where they actually cut that deep transverse metatarsal ligament in an effect to help take away some of that pressure on the nerve. The other option is removing the nerve completely, and so that's a neurectomy. So if you're dealing with this issue, there is definitely treatment available for you, and I hope you found this beneficial.